Hi, my name is Dr. Francois, and I'm a general anesthesiologist. Some of you may remember me from my other channel, 3 Anesthesia and Me, where I discussed a bit of my home life with my kids and my husband, and also my life at work as a general anesthesiologist. In this channel, I wanted to take another look at things and talk to you guys about some of the special, unique, and interesting patient cases that sometimes come up. So these will be dramatizations of actual case reports from patients that have been published in journals and different studies. So we'll look at them together and discuss what is going on and what's the anesthesia behind it. Let's jump right into it. The first case is going to look at a patient who experienced something called anesthesia or intraoperative awareness. Now, this is a topic that a lot of people are concerned about. My patients ask me about it, and also a lot of YouTuber comments have really hinged upon the fear of this happening. So why does this happen and what's really going on? So we'll watch this case and we'll do a brief analysis at the end to highlight some of the points of why this happens, how often it happens, and what are some of the risk factors for it. And remember, these cases are rare, exceptional experiences and are not the normal that people have. So our first case for your analysis is that of a patient having intraoperative awareness, or anesthesia awareness as it is most commonly called. Let's take a look at Donna's story and find out why this happened to her, what things could have prevented this from happening, and also what are the possible ways as anesthesiologists, doctors, and the like we can be better servers of our patients. Once again, for your analysis.
It can be the smallest event that triggers Donna Penner's traumatic memories of an operation from more than 10 years ago. One day, for instance, she was waiting in the car as her daughter ran an errand and realized that she was trapped inside. What might once have been a frustrating inconvenience sent her into a panic attack. "I started screaming. I was flailing my arms. I was crying," she says. "It just left me so shaken." Even the wrong clothing can make her anxiety worse. "Anything that's tight around my neck is out of the question because it makes me feel like I'm suffocating," says Donna, a 55-year-old from Altona in Manitoba, Canada. Donna would not be like this if it were not for a small medical procedure that she had before her 45th birthday. She was working in the accountancy department of a local trucking company and had just celebrated the wedding of one of her daughters. But she had been having severe bleeding and pain during her period, and her family physician had suggested that they investigate the causes with exploratory surgery. It should have been a routine procedure, but for reasons that are far from clear, the general anesthetic failed. Rather than lying in peaceful oblivion, she woke up just before the surgeon made the first cut into her abdomen. With her body still paralyzed by the anesthetic drug, she was unable to signal that anything was wrong. So she remained frozen and helpless on the operating table as the surgeon probed her body, while she experienced indescribable agony. "I thought, this is it. This is how I'm going to die, right here on the table, and my family will never know what my last few hours were like because no one's even noticing what's going on." The lingering trauma can resurface with the slightest trigger and still causes her to have 2 or 3 nightmares each night. Having been put on medical leave from her job, she has lost her independence. She suspects that she will never fully escape the effects of that day more than a decade ago. It's a life sentence. For years, anesthesia awareness has been shrouded in mystery. Although extreme experiences like Donna's are rare, there is now evidence that around 5% of people may wake up on the operating table, and possibly many more. Thanks to the amnesiac effects of the drugs, however, most of these people will be unable to remember anything about the event. And whether or not that is something we should be concerned about is both a practical and a philosophical question. These results are all the more significant given just how often general anesthesia is now used. 20 million general anesthetics happen each year in the USA alone, Dr. Francois says. As a consequence, it is more probable than not that someone somewhere in the world right now is aware during their surgery. We once knew surprisingly little about why anesthesia works. Now, however, researchers are striving to understand more about the nature of going under and the circumstances in which anesthesia doesn't work, in the hope of making advances that might reduce the risk of anesthesia awareness. And with a greater understanding of the anesthetized state, we may even be able to turn a rudimentary awareness to our advantage in the form of medical hypnosis.
Wow, what a very horrific experience this woman had. I hate to hear about these stories, although again, they're very rare, and in my experience, the frequency of these occurrences has been pretty much minimal to zero. So I think, we need to look at why this happens in some patients. We need to get a better understanding of some things that we can do to prevent this from happening. So I just wanted to kind of go back. In this case, Donna discussed, her experience and how it made her feel, what she felt after the event, and how it lingered years and years later. And I wondered, what was the eventual outcome, from her doctors and her healthcare providers, especially the anesthesiologists. What were their reactions and what did they say after this occurred? And in looking at Donna's case report, I saw that she had met with her anesthesiologist and her surgeon after the incident to discuss with them what happened, and essentially no one issued her an apology. No one described to her why this could have happened, and no one discussed with her feelings. This is part of your job, your role as a physician, but in general, if something happens between you and another person and they are offended by your actions, usually people apologize. I think here in this case, and in any case, that could have been a better way to approach it. Even if you don't feel that the fault is 100% yours, you were doing your due diligence in your opinion, you should still apologize if they feel like they are offended by your actions or they feel harmed by your actions. So in looking deeper, it took 6 years before an apology was issued, and that was only after Donna had filed a lawsuit. So again, the same applies. People should really think about those things in the healthcare setting when they're taking care of patients. So now, what are our risk factors for intraoperative awareness? As I mentioned in one of my previous videos on my other channel, 3 Anesthesia and Me, intraoperative awareness or anesthesia awareness is very rare. It occurs in about 1 to 2 per 1,000 anesthetics. So that is less than 1% for sure. Most of the risk factors include age, so those extremes of age, usually the older populations, of course, they can actually recall and let you know as opposed to a child. Limited cardiac reserve, so patients that are undergoing heart surgery that may not be able to tolerate as much anesthesia as someone with a healthier heart. And the use or abuse of substances such as cocaine, alcohol, benzos, marijuana, etc. Or any patient that may have or be at risk for a difficult intubation. So these are most likely the patients that are going to have some type of intraoperative recall in the routine circumstance. Now, there are always other cases of surgery that are not routine that are a higher likelihood to have intraoperative awareness, such as traumas or patients who are undergoing emergency C-sections. So again, those are emergency situations in which the goal is to get the patient stable or to quickly deliver a baby, and not so much as to giving the patient adequate amounts of anesthesia, especially if their blood pressure is unstable. What we can do in these patients that have higher risk factors, such as the ones mentioned before, we can look at ways to monitor the patients more closely to figure out whether or not they may or may not be feeling the surgery itself. So for Donna, she could have had a myriad of medical conditions that we didn't really know about from the case report. Donna could have been on a drug called a beta blocker, and beta blockers basically slow down the heart. If someone has high blood pressure or they're at risk for heart disease for any reason, they might be placed on beta blockers by their doctors. And what these beta blockers do is make the heart rate slow and pretty much reduces the risk of having heart disease on that patient. A lot of times when someone is becoming light during anesthesia, or their anesthesia is wearing off, when you're finished with the surgery and you're turning off everything to wake them up, their heart rate may start to increase. And that is one of the signs that someone is more perceptive or feeling the surgical stimulus, or that they're waking up. When a patient is on a beta blocker, they won't do that. So their heart rate stays slow, and no matter what's going on, be it a stimulating thing or not, their heart rate won't really reflect that. So in 2006, there was a task force developed by the American Society of Anesthesiologists that looked at intraoperative awareness and prevention. And they developed this practice guideline to help anesthesiologists identify this phenomena and reduce the causes. So they looked at all those risk factors: age, cardiac reserves that are limited, so someone with heart disease, anyone could possibly have a situation where they had a history of a difficult intubation, or if they have any evidence of a history of resistance to drugs. So for example, if they were prescribed drugs and they didn't seem to respond to normal doses, those patients may be in the risk factor group. And then again, otherwise, people who have a history of substance abuse. So whenever those kind of patients present in the pre-op setting, as an anesthesiologist, you are looking closer at those patients during the procedure, and you want to make sure that you're very much giving them the full attention that you need to prevent this type of phenomena. So a lot of the unknowns are still present with this. Patients can have the episode and have exhibited no signs or no risk factors. Sometimes it is just a thing that occurs without any warning. In those cases, we need to be open to our patients and listen to them and understand their concerns and their fears. And always apologize if there's an issue the patient feels was harmful or affected them negatively.